Welcome to Health Living Chronicles. Today we're diving into a serious health concern, sleep apnea. Sleep apnea is a common but potentially dangerous disorder characterized by interruptions in breathing during sleep. These pauses can last for seconds or even minutes and may occur many times throughout the night. This condition affects millions of people, both adults and children, and can lead to serious complications if left untreated. Let's explore the three main types of sleep apnea, their causes, and treatments. There are three primary types of sleep apnea: obstructive sleep apnea, central sleep apnea, and mixed sleep apnea. Let's start with obstructive sleep apnea, or OSA, which is the most common form. It occurs when the muscles at the back of your throat relax and block the airway. Central sleep apnea, or CSA, happens when the brain fails to signal the muscles to control breathing. Lastly, mixed sleep apnea is a combination of both OSA and CSA. And then let's dive into the causes and risk factors of each. Obstructive sleep apnea happens when the muscles in the back of your throat relax, blocking your airway. There are several risk factors that increase the likelihood of developing OSA. These include smoking, nasal congestion, obesity, and a narrowed airway, aging, a family history of sleep apnea, and the use of alcohol or sedatives also play a role in increasing risk. OSA is common among middle-aged adults, particularly those around 55 to 60 years old. On the other hand, central sleep apnea occurs when your brain fails to send the right signals to your breathing muscles. This form of sleep apnea affects less than 1% of people, but can be just as dangerous. Factors that contribute to CSA include aging, strokes, heart disorders, and the use of narcotics or pain medications. Central sleep apnea is often harder to detect because it is not caused by an obstruction in the airway, but rather by a communication breakdown in the brain. People with sleep apnea experience a variety of symptoms. Common signs include loud snoring, waking up with morning headaches, trouble concentrating, and feeling excessively tired during the day. Other symptoms include waking up with a dry mouth, sore throat, or gasping for air. Many people with sleep apnea may not even realize they have it, but these symptoms are important to look out for. Sleep apnea can be diagnosed through a combination of symptom assessment and overnight monitoring of your body's activities while you sleep. The standard test for sleep apnea is polysomnography, or a sleep study, which records vital information such as your sleep stages, heart rate, oxygen levels, muscle activity, and breathing rate. For some, home sleep apnea testing, or HSAT, may be used as an alternative. A sleep study helps determine the severity of your condition, which can range from mild to severe based on the number of episodes of apnea per hour. For less severe cases of obstructive sleep apnea, lifestyle changes such as smoking cessation, weight loss, and treating nasal congestion may be enough to improve symptoms. However, when these measures are insufficient, more advanced treatments are available. Continuous positive airway pressure, or CPAP, is the most common treatment for OSA. It uses a machine that provides a constant flow of air through a mask, keeping the airway open during sleep. Other options include oral appliances and expiratory positive airway pressure, or EPAP, which also help open blocked airways. In cases where other treatments fail, surgery may be considered for obstructive sleep apnea. Surgical options can include the removal of excess tissue from the throat, repositioning the jaw, or even creating a new passageway to improve airflow. These options are typically reserved for severe cases, and your doctor will work with you to determine the best course of action. For central and mixed sleep apnea, treatment options vary. Supplemental oxygen may be used to ensure adequate oxygen levels during sleep. Adaptive servoventilation or CPAP therapy can help regulate breathing patterns, and bilevel positive airway pressure, BiPAP, is often used for more complex cases. These treatments help keep the airway open and regulate the breathing cycle, providing relief for those with central or mixed sleep apnea. Sleep apnea is a serious condition that can greatly impact your health and quality of life. If you suspect you may have sleep apnea, don't wait, consult a healthcare professional to explore diagnosis and treatment options. Lifestyle changes, therapy, and even surgery can provide significant relief. Stay healthy and remember to prioritize your sleep for a better tomorrow. Don't forget to like, share, and subscribe to Health Living Chronicles to stay updated with more insightful videos on health and wellness.